Good morning, everyone. My name is Haidong Kan. I'm very happy to be here to talk about air pollution and the related health effects in our Asian region. So first, I'm going to talk about the air pollution level in our region. You can see that this is a global picture about outdoor and indoor air pollution levels in the world. And we can see that for major outdoor air pollutants, including PM2.5, ozone, and nitrogen dioxide, the air pollution level in our Asian region is much higher compared with other parts of the world, especially the Western countries. And for indoor air pollution, a substantial part of our Asian population are exposed to indoor solid fuels. So for PM2.5, this is the average annual population-weighted PM2.5 levels in major countries in the world. And we can see that for two major Asian countries, including India and China, the population-weighted PM2.5 level are much higher compared with the global average, and is also much higher compared with Japan and USA. How about the disease burden? This picture shows the percent of total deaths attributable to air pollution in the world. And we can see that in China, over 20% of total deaths can be attributed to air pollution. And in India, over 10% of total deaths can be attributed to air pollution. This slide shows the cause-specific deaths attributed to air pollution in Asia in the year 2021. And this is from the Global Burden of Disease study. And we can see that in our Asian region in the year 2021, heart disease, stroke, COPD, and lung cancer are major cause of death in Asian population. And for heart disease, over one-third of heart disease and one-third of stroke deaths and one-fourth of lung cancer deaths and over half of COPD deaths can be attributed to air pollution. So we can see that air pollution is a major disease, a major risk factor for our Asian population. Let's talk about health evidence for air pollution in Asia. And this is PAPA study. PAPA study is the short name for public health and air pollution in Asia. And this was the first multi-city study in our Asian region about air pollution. And the PAPA study includes 3 Chinese cities, Hong Kong, Shanghai, and Wuhan, and 1 city in Bangkok, where this conference is held. And I was the PI for PAPA Shanghai study. This is a picture for the PAPA team, and several teams are from local here in Bangkok, and a lot of people here are still very active for air pollution health research. And here is the result for PM10 in the PAPA 4 cities. And we can see that for the 3 Chinese cities, Hong Kong, Shanghai, and Wuhan, the effects of particle PM10 are very similar across the 3 cities. But for Bangkok has the biggest but less precise effect response coefficients than the 3 Chinese cities. And this is the results for another air pollutant, sulfur dioxide, and similar exposure response functions across Asian cities, but less precise in Bangkok. And for NO2, the effects of NO2 in Bangkok and Wuhan are very similar, but for Hong Kong and Shanghai, the effects estimate were much lower compared with Bangkok and Wuhan. And this is the results for ozone, and the 3 Chinese cities share very similar findings, but for Bangkok, the effects of ozone are much higher compared with the Chinese cities. So this is the concentration response curve for particle, and we can see for every cities in Asia, we can see that almost linear dose response relationship between particle and death risk. And even below the current air quality guideline, we can still observe significant health effects. After PAPA, there are several major multi-city studies of air pollution in our region. This is a HEATER study, health effect of air pollution and temperature in Asia, and Professor Kim was the PI of HEATER study. And this study includes 7 cities in Korea, 7 cities in Japan, and 17 cities in China mainland, and 3 cities in Taiwan. And for example, this is one of the study in HEPA. And in this study, significant effects of ambient ozone was observed on daily mortality. And we also have some very interesting findings that the ozone health effect was much apparent in spring and summer. I mean, compared with the winter and fall. And this is the latest study about air pollution and health effects. Actually, this is a global study including 6 continents, 24 countries, and 652 global cities. And in our Asia, the countries include China, Japan, South Korea, Taiwan, and Thailand. Here is the country-specific finding for PM10 and PM2.5, and we find that in different Asian countries, the effects estimate differ a lot. I mean, for different countries, per unit increase of PM10 corresponded to different increased risk of mortality in different Asian countries. For long-term exposure study, actually there are much fewer air pollution cohort studies in Asian region. Here is one example from China. This is the Chinese healthy longevity cohort study. And we can see that the cohort participants were from different parts of China. And this is the exposure response curve for PM10 and long-term mortality risk. We can find even below the Chinese air quality standard or WHO air quality guideline, the PM2.5 still have significant effects of air mortality risk. So, can we prevent air pollution related hazards in Asia? Actually, I think China has maybe a good example to control air pollution. About 20 years ago, the Chinese government invested a lot of money to control air pollution, and they implemented 2 major policies. One is China Air Pollution Prevention and Control Action Plan, and the other is China Blue Sky Protection Campaign. And we can see that after 10 years, the PM2.5 level in China, decreased a lot. For major cities like Beijing and Shanghai, the PM2.5 level decreased about 50%. And for ozone, the major trend was also decreased. And there are several very successful air pollution intervention studies in our region, showing that if the government take measures to control air pollution, and the local population can get a lot of health benefit. I think this is a very example from Beijing Olympic Games. Here is a comparison of typical air pollution day in Beijing, the same place and good air quality day during the Beijing Olympic. We can see totally different scenarios. And this is a study published on JAMA, and the Beijing Olympic study, the name is HOT, 3 periods, pre-Olympics, during Olympics, and post-Olympics. Very, very significant health benefit. And in addition, studies in Asian region have found some personal intervention measures are also very effective. For example, when people spend time outdoors, they can take masks to protect themselves. When people are indoors, they can use air purifier, and some kind of dietary supplement may help people to control air pollution related health hazards. But there are a lot of limitations for Asian air pollution studies. For example, most studies were conducted in cities, and most on particles, very few on ozone and nitrogen dioxide. And very few studies are focused on specific sources such as traffic. And I believe there are a lot of future research needs in Asia. For example, we need more air pollution cohort study in our region. We need more intervention study for longer intervention periods and more health outcomes. And we need new technologies to be used in air pollution epidemiology in our region. For example, more sensors with big data. We need new technology like source apportionment. We need to use satellite data, air pollution modeling, and omics technology in air pollution epidemiology. So I'm going to stop here and thank you very much for your attention. Thank you.